Imagine someone you know is suffering from massive multi-organ system failure. Like their heart muscle is actively deteriorating, their core body temperature is just plummeted because they can't maintain basic thermoregulation, and their bone density is severely, permanently compromised.
Right, a complete medical emergency.
Exactly. Imagine that instead of rushing this person to an emergency room, society looks at them and, well, praises them for their incredible discipline. People ask them for their secret. They tell them they look fantastic.
I mean, it sounds like some sort of dystopian novel, but you're basically describing the daily reality for a massive percentage of people suffering from eating disorders right now.
Yeah, and that's why we're bringing you on a custom-tailored deep dive today. Our mission for you listening is to really dismantle the pervasive, dangerous myths surrounding anorexia and nervosa and explore the modern landscape of telehealth treatment.
Which is so needed, especially right now.
Definitely. And our insights today come directly from clinical practice materials provided by Coping and Healing Counseling, or CHC. They're a comprehensive telehealth therapy practice based out of Georgia.
Yeah, and their on-the-ground insights are just incredibly revealing.
They really are. And we know you want thorough knowledge without being completely overwhelmed, so we promise to balance these stark clinical realities with deep empathy and, actionable solutions.
Because we aren't here to rehash those old 1990s era debates about whether anorexia is just like a vanity project.
No, not at all. Okay, let's unpack this. Because treating anorexia like a vanity project is basically like telling someone with a broken leg that they just chose a unique way to walk.
That's a really good way to put it.
It represents a fundamental failure to recognize its severe illness. I mean, the disconnect between public perception and medical reality is just stark.
It's deadly, honestly. The clinical facts from the CHC materials show that anorexia nervosa is one of the most serious mental health conditions in existence. It carries one of the highest mortality rates of any psychiatric illness.
Wait, highest? Of any psychiatric illness?
Yes, it is incredibly lethal. And that's why it's so crucial to properly define it as a biological and psychological illness, characterized by severe energy intake restriction, an intense fear of gaining weight, and a profoundly disturbed experience of one's own body.
Right, and building on the fact that the actual nature of the illness is misunderstood, the way it looks from the outside is completely misunderstood too.
Absolutely. The visual stereotype is actively harming people.
So I have to ask you, if society falsely equates anorexia exclusively with being visibly dangerously thin, how do we reconcile the fact that people who do not look underweight are in equal medical danger?
What's fascinating here is the concept of atypical anorexia. And, clinically, it's a deeply frustrating term for a lot of practitioners.
Because atypical sounds like it's rare.
Or less severe.
Exactly. It makes it sound like a mild version. But a person absolutely does not have to look visibly underweight to be in mortal danger. Atypical anorexia carries the exact same severe medical risks. It's purely a diagnostic term related to body mass index. So they might have a normal BMI or even be classified as overweight.
Right. But starvation is a biological process, not a weight class. The human body is incredibly efficient, but it's completely blind to our modern aesthetic goals. It doesn't know you're trying to fit into a certain size.
It just thinks there's no food left in the world.
Precisely. It only knows a famine has hit, and it goes into extreme systemic triage. The source details physical warning signs that happen regardless of a person's outer size. Things like profound fatigue, dizziness, and cold intolerance.
Cold intolerance. Is that just because of a lack of body fat for insulation?
It's way more active than that. Your body literally shuts down the biological thermostat. Heating your hands and feet takes a massive amount of metabolic energy. So it constricts blood vessels in the periphery and pulls blood flow inward to protect vital organs.
Oh, wow. Which I guess explains the hair loss mentioned in the notes, too.
Yeah. Growing hair and nails is a biological luxury. In a famine, your body stops wasting energy on keratin. You also see the loss of menstrual periods. The body effectively says, we cannot sustain a pregnancy in this environment.
It shuts it off.
Completely shuts it down. And worst of all, when the energy runs out, the body begins to cannibalize its own tissue. It breaks down muscle, including the heart. So you see dangerously low heart rates in patients who might look perfectly healthy to their primary care doctors.
That is terrifying. Since physical appearance isn't the true indicator, we really have to look at the psychological drivers beneath the surface. The notes mention dramatic food restriction, skipping social events, excessive exercise, and these really rigid rules around eating.
Which from the outside just looks like a food obsession.
Right, but here's where it gets really interesting. I like to think of these rigid rituals as a complex control panel.
A control panel.
Yeah, imagine a person builds this elaborate control panel with hundreds of delicate switches and dials when the rest of their life feels completely out of control. It's not actually about the food, it's about having something they can absolutely control. But eventually, they trap themselves inside the room with that panel.
That is a phenomenal analogy. The clinical text absolutely validates that. Anorexia is driven far more by anxiety, perfectionism, control, and underlying trauma than by food itself. Food is just the unavoidable biological input they can exert absolute will over.
So they use it to manage profound anxiety.
Exactly. And if we connect this to the bigger picture, understanding these root emotional drivers fundamentally changes how clinicians and loved ones must approach the illness.
But logistically, this creates a massive catch-22, right?
Yeah.
If the patient's brain is physically starved and lacking the neurochemicals to process complex emotions, how do you even address that trauma?
You've hit on the hardest hurdle in treatment. You cannot do deep trauma processing on a starved brain. And patients often have anosognosia, which is a neurological inability to even recognize they are sick.
So they genuinely don't see themselves as ill.
Right. Their compromised brain perceives their suffering body as perfectly fine. So refeeding and physical stabilization absolutely have to come first, or at least alongside the therapy.
So what does this all mean for the person listening? I mean, against such an entrenched high mortality illness, is recovery even possible?
Yes. I want to reassure you listening right now, evidence-based treatments genuinely work.
Yeah.
The source material outlines very specific clinical interventions that save lives.
Okay, let's break those down. What's the approach for adolescents?
For adolescents, the gold standard is family-based treatment, or FBT.
Now, FBT sounds like sitting around a table having family dinner and talking about feelings.
It is much more intense than that. FBT deputizes the family as the primary recovery team. The parents temporarily take absolute control over the child's food choices, portion sizes, and eating schedule.
Wow. Taking control away from a teenager whose entire illness is built on control, that sounds like an emotional powder keg.
It is incredibly difficult. That's why a trained clinician is required. The therapist helps parents separate the child from the illness. And crucially, FBT is agnostic about the cause in the beginning.
Meaning they don't care why it started.
Right. It treats the starvation like a burning house. You don't stand in the yard debating how the fire started, you put the fire out. Once the child is renourished and cognitively stable, then you explore the psychological roots.
Got it. But what about adults? The burning house protocol doesn't really work if you're 25 and living alone.
True. For adults, the notes highlight Enhanced Cognitive Behavioral Therapy, or CBTE. This directly targets that control panel you mentioned.
How does that work? You can't just tell someone, hey, you need to eat.
No, it's highly systemic. A therapist helps the patient identify their specific distorted cognitions, like the belief that their self-worth is intrinsically tied to restricting intake. And then they dismantle those through guided behavioral experiments.
Like having them eat a feared food and analyzing the actual outcome versus their fear?
Exactly. Over time, it rewires the brain's response to anxiety. But therapy alone isn't enough. Both FBT and CBTE require coordinated medical and nutritional care.
A whole team. A doctor, a dietitian, a therapist.
Right, and a diagnosis absolutely must be made by a licensed clinician. Early intervention is the single biggest factor in dramatically improving recovery odds.
Which naturally leads us to the final, most practical hurdle. How do people actually get access to this highly specialized care? Historically, it's been like a luxury service for the wealthy.
It was geographically limited and prohibitively expensive, yes.
But this is where Coping and Healing Counseling, CHC, really shines as an example of removing those barriers. They operate on a massive scale. We're talking 100% telehealth, APA-compliant services provided to all 159 counties in Georgia.
That scale is vital.
And they have a team of over 15 licensed therapists, including LCSWs, LPCs, and LMFTs. Plus, telehealth seems uniquely suited here because the real anxiety doesn't happen in a sterile medical office. It happens at the dining room table in the patient's own home.
That is spot on. And this raises an important question. Who traditionally gets left out of care? The media stereotype leaves out marginalized communities. But CHC has a diverse, culturally competent team offering eating disorder-informed care for individuals, couples, families, and teens starting at age 13.
And they offer life coaching too, right?
Yes. And they coordinate directly with medical providers. But importantly, cultural competence matters deeply when dealing with food because food is so intrinsically tied to culture and heritage.
Right. But what about the financial barrier? Because specialized therapy can cost hundreds out of pocket.
CHC actively removes that financial wall. They accept major commercial plans like Aetna, Cigna, Blue Cross Blue Shield, United Healthcare, and Humana.
So what does a session actually cost then?
With those plans, it drops to just $10 to $40 a session. And for patients on Medicaid, they have a $0 copay.
A $0 copay. That's incredible. That's the difference between actually recovering and having to quit because you can't pay rent.
Exactly. It makes long-term, sustained therapy truly accessible.
Well, we have covered an immense amount of ground on this deep dive for you listening today. We started by shattering that deadly myth of anorexia as just a vanity choice. We looked at the biological reality of starvation and atypical anorexia.
We uncovered the hidden emotional engines of control and trauma.
Yeah, and we ended with the real hope of accessible, evidence-based telehealth treatments through practices like CHC.
As we wrap up, I want to leave you with one final provocative thought based on the source material. We know early intervention dramatically improves recovery odds, but society's false belief that you have to look underweight to be sick actively prevents that intervention.
Oh, true.
So I want you to ponder this. How many people in our society, in your own life, are quietly exhibiting the rigid rituals and physical exhaustion of atypical anorexia right now, but are tragically being praised by our culture for their discipline instead of receiving the life-saving clinical intervention they so desperately need?
It's a chilling thought, but it really emphasizes why we have to keep questioning our assumptions, look beneath the surface of what society praises. And hey, if you or someone you know in Georgia needs the specific help we discussed today, you can access it by visiting khtherapy.com or by calling 404-832-0102. Thanks for joining us on this deep dive.